Hello, my name is Paulina Krasik. I go to Cedar Crest College, and today I'll be presenting my paper for Nursing 322. My paper is called Spirituality and Spiritual Caring, a Nurse's Perspectives and Practice in Palliative Care in Acute Care Settings. This paper is written by Susan Ronaldson, Lillian Hayes, Christina Agar, Jennifer Green, and Michelle Carey. So the first thing we're going to talk about is the research problem. So the research problem is that many of the nurses do not practice spiritual care. They do not know what it means for them, and they do not know what it means to do that as a nurse with their patients. They do not implement the spiritual care due to not knowing the definition. So the research purpose, the purpose of this paper was to identify and compare the spiritual care practices between the palliative care and acute care nursing. Another purpose was to determine if there's a correlation between the nurse's personal spiritual beliefs and the way she implements that in her nursing work. And then the last thing we're going to talk about is the investigations, the barriers to spiritual care. So the significance of the study, they hope to raise awareness of spirituality and the importance for the upcoming nurses to understand the barriers that they will face. This is relevant to nursing because spiritual caring is key to the holistic approach, rather than the curative approach that is used in acute care settings. So for the interventions and the conceptual models, there were no independent or dependent variables found, and there is no conceptual method. The theoretical framework that was used was by someone called Carper in 1978. They used this framework of analyzing nurses through knowing and experience. They analyzed concepts of spirituality and spiritual caring by analyzing nurses' knowing through their experience, their education, how many years they've worked there. So the sample size, they used 7 inner metropolitan health services in Sydney, Australia. They used 4 palliative care health services and 3 acute care services. They used a total of 92 nurses total between all 7 locations. 42 were from the palliative care and 50 were from the acute care. So some of the inclusions, they included specialties that were recommended by the directors of nursing services. Some of those specialties were general surgery, orthopedic, medical, and coronary care units. And they excluded the specialties that were high dependency due to the fact that nurses needed to be with their patients. They also excluded specialties that were not relevant to either palliative care or acute care settings. So for the ethical component, the director of nursing services was contacted and they approved the nursing staff to participate. So every nurse voluntarily signed and they agreed to the study. They also had the ethical component of it. So the ethics approval was obtained by the Institute of Ethical Committee. So for the data collection procedure, this was a cross-sectional study, which means they gained their data from various places. So like we mentioned before, they gained their data from 7 different hospitals in Sydney, Australia. And they got their data over the course of 6 months. The demographics that they include was age, employment history, gender, basic qualifications, and cultural background. They also used questionnaires such as the SPS, which is the Spiritual Perspective Scale. The Spiritual Perspective Scale measures a person's view or the extent of how spirituality impacts their personal life. For this study, they used a Likert scale, so a 1 to 6 scale. They also used another questionnaire called the SPCQ, which stands for Spiritual Care Practice Questionnaire. So this one differs because this one measures how often they use spirituality as a nurse and if there's any barriers that they face when using that. So for the results, they found that palliative care nurses scored higher on both SPS and SCPQ, and they found a significant difference between palliative care and acute care nursing with their age, their years of experience, educational levels. So with the age, palliative care nurses were usually older. They were more experienced in that field particularly, and they had more certificates rather than bachelors. With the acute care settings, those nurses were usually younger. They didn't have much of experience, and they had a bachelor's of nursing, which is now required. So they both were alike in the sense that they both ranked insufficient time as one of the barriers to their spiritual care. And then specifically for acute care nurses, they ranked patient privacy as another barrier. Due to the fact that usually when you come in and med-surg, people usually share a room together, which is different from palliative care, because usually if you're in hospice, you usually have your own room, and patient privacy differs in those two settings. So the limitations to this study, RNs were recruited from a targeted number of care settings because they wanted to limit the diversity between acute care specialties. So like we mentioned earlier, those specialties were medical and coronary units and general surgery with orthopedics. So the implications for practice. Why did they do this study? What did we get out of this? So they wanted to increase spiritual knowledge, awareness, and caring. And they wanted to do that because they wanted to implement the spirituality early on, to educate the early on nurses, and to promote holistic approaches rather than typical curative. They also did this to make people aware of what it is that makes spiritual care a barrier. So like we mentioned earlier, patient privacy and insufficient time. So in conclusion, regarding nursing, you do want to teach nursing about spirituality early on in their career. So that's important because if we teach it early on, they can start thinking about it and how they can move on with the barriers. So once we get the nursing students to understand that, we need to start incorporating the spiritual component and how we can implement that regardless of their setting. And like I said before, so in order to have the spiritual care in settings like the acute care settings, nurses need to be focused more on the whole person as a whole rather than just fixing the problem. So if somebody comes in with just shortness of breath, you don't just want to cure that. You want to really get to know the person and understand what really causes them. Get into that psychosocial, okay? And then we have the Ronaldson, Hayes, Agar citation.